Got something to say? Get in on the conversation at 415-915-2291. That's 415-915-CALL-1.
Welcome to Conspiracies Against Wellness with your host, Janelle Elgaway.
Good evening. Welcome to Conspiracies Against Wellness. I'm your host, Janelle Elgaway. If you have a question or comment tonight, please call in at 415-915-2291 or call 1. Last night we played an audio of a baby getting circumcised, which was heart-wrenching. We will replay a partial of this again tonight. Also tonight, Justin joins us again to further explore this topic and the controversy surrounding circumcision. Welcome back, Justin. How are you this evening?
Hi, Janelle. Good. How are you?
I'm doing good, thank you.
No, Janelle, I watched a replay of the show, and I saw how you reacted to watching that baby be circumcised, and that is exactly why they don't want parents in the room to see it, you know, because parents will go in and tell the next parent, oh, my God, it was the worst thing ever, and then they don't circumcise.
Yeah.
That's why they always try to keep you guys out.
Well, and I know our viewers couldn't see the video, but I was watching it off of our other screens, and I mean, the sounds alone were really, really bad, but watching it too, I couldn't take it. It was too much for me, honestly. And we're going to do it again tonight because I think it's important that we do it.
Do it again tonight. Yep. Yeah. Thank you. Thank you for going through that, because it's seriously a traumatic thing to watch that baby be strapped down. You know what I mean? It's the image of it is just extremely disturbing when you've actually seen it. You know, the people, they take this brand new, healthy newborn baby, cozy as can be, they take it away from mom, and they strap it down as tightly as can be, you know, and they go to work with, you know, knives and scalpels on the child's genitals that are totally healthy. And it's just, I mean, it's an agonizing procedure. And the baby we saw in that video, you know, I think he tolerated it. This might sound really sick, but he tolerated his circumcision pretty well. You know what I mean? He didn't go completely unconscious during the procedure. So, you know,
and normally they do.
Okay. Even though,
yeah.
Even though he was, babies often do. They'll gurgle and they'll spit up, and they'll vomit sometimes during the procedure. They will poop themselves. Lots of times you'll go to the doctor, take your baby there, and they'll ask you a question. You know what I mean? Was he circumcised? And a friend of mine asked, why do you ask that question? And they're like, well, sometimes babies, you know, have damage to their eardrums from the crying and screaming during the circumcision.
Wow.
So there's lots of different kind of complications that can happen during the procedure.
Well, we're going to get into those. A quick question before we listen to the audio again. Today, how many babies are being circumcised?
Today, it depends on the area of the country that you're in. Out in California, it's about 1/3, about 33%. If you go into the Southwest, sometimes it's lower numbers. If you start moving out into the Midwest, the numbers start to jump up. The Midwest has some of the highest circumcision rates, which might be today around like around 7 out of 10, 70%. Slightly less in the Northeast.
Why
but,
is that?
You know, it generally today it's becoming more around like 60-40. You know, so and that's really great, because that helps to destroy one of the excuses that the circumcisers like to push. And that's that, oh, if you don't do it, your child's going to be, you know, different than all the other boys when they compare penises in the showers, I guess. Mm-hmm. But, yeah, so today, nope, it's going to be, depending on where you live, if you circumcise your son, he might be the outcast, you know. Not that that's any reason to circumcise or not. In other parts of the country, it's 50-50. So the boys will see half are circumcised, half are not. Everybody will be used to seeing foreskins. And honestly, it's the circumcised boys that are going to feel, they're going to be wondering, hey, what happened to me? Why is part of my penis missing and not from all these other guys? And then they're going to research it and find out how truly messed up it is. And they might not be feeling too great about that because they can never get back their foreskin. They cannot put back on all those nerve endings and all of the functions. If the boy is intact and he's really upset about it and he wants to be circumcised, he could always get cut. You can get cut at any point in your life if you really want to. But usually when guys want to get cut, there's some kind of an issue with their self-esteem. They've been bullied by somebody, so they just kind of need a talking to, a little education on why they're lucky, and then they kind of get that idea out of their head.
Have the rates of circumcision fallen or risen at all over in the last few years?
So the rates of circumcision are plummeting.
Okay.
Now with the advent of the internet, circumcision was great back in the old days because it could live in the darkness. Nobody knew anything about it. There was no internet. If you wanted to research, you had to go to the library. So people just trusted the doctors because that was their only source of a clearinghouse of great information. So they thought, today we have the internet. We could watch videos of what the circumcision actually looks like. We hear about, the baby died in Texas. He bled to death. We could do the research ourselves, look at the studies from around the world. And, we can make an informed decision today. And parents are dropping and abandoning circumcision in droves. And shows like this, parents will hear the sound of the baby being circumcised and they're going to say, nope, that's not for my child. Let somebody else, if they want to cut up their child, they can do that, but not me, not my baby.
Well, let's go ahead and let's listen to the audio again. We're going to just show just a smaller part tonight, not as long as it was.
Yeah. Oh dear.
Are you ready? Audio? Okay.
I'm ready.
Done here is he's completely separated all the skin from the head. You can see the outline of the head of the penis, right? Yeah. So we're taking the skin right down here, right? Right down to that level that you're talking about. No, that just crimps the whole thing. That's it for just a moment. Okay, release his arms so he feels less.
Okay. I didn't want to listen to it again tonight. It just bothered me too much yesterday. So
I know it's traumatic. It's disgusting.
Yeah. And yesterday we weren't able to really hear what you were saying during the audio, but can you tell us or walk us through, paint a picture of exactly the entire process of what happens? Because I think you were trying to say it, but between the audio from that and you got drowned out a little.
Okay, I'll tell you. I can tell you what I saw.
Okay.
And it's a truly disturbing and it's a bizarre situation because if you're a new nurse, you're taken into this situation and they are, kind of like indoctrinating you. This is how you will react while you're here. Everybody's calm. We don't get upset. They usually don't like parents in the room before, because they don't want anybody getting very upset. And that's taught to you, when you're going through school. You have to have a very flat affect. It's called clinical detachment. So, whatever you see, you do not react to it emotionally. So they bring in a newborn, okay? Baby is put down and strapped down to this little plastic board with the outline of a baby on it. And it's imprinted with the baby outline. He's lied down flat, and they strap the arms and legs down tightly to the board. And so the infant cannot move, he can't wiggle, he can't do anything. Okay. Can you hear me, Janelle?
Yeah, I can hear you.
Okay. So after that, the baby's strapped down tightly. They remove the baby's diaper. The baby usually gets agitated at being strapped down. Then they clean the area of the penis with betadine, and they they have their tools set up. And there's a lot of tools to do a circumcision. Parents sometimes think, oh, it's just a little snip, or or they just use this little plastic thingy. No, there's many tools that are used. The first thing they do is they grasp the foreskin, this tiny little baby's penis, with 2 clamps on each side. And when the clamps attach, they start crushing the skin, and the baby screams. Then they actually have to, wrench the foreskin open, because at that age, the foreskin of an infant is naturally very tight. It has muscle fibers that keep it tight, except for when the baby's peeing, and that keeps out all the bad stuff. So they open it up, and they take a metal probe, and since the foreskin is fused to the head of the penis, like your nail is to your finger, they have to go in with this probe and jam it in there and move it around and break up all the attachment points, which is pretty much the entire head of the penis. So the entire head of the penis and the top layer of the foreskin have been torn. And it's incredibly painful. I mean, the baby screams. Right after the first 2 clamps were applied, it's horrible. When they use the probe and they start breaking those adhesions, the babies just scream in the worst possible way you can imagine. Mm-hmm. I cannot believe it. And watching these people, these doctors and nurses, have absolutely zero reaction to what this baby was going through, gave me the impression, oh my God, this is an insane procedure. Look what we're doing to this infant. It's going through this incredibly terrible trauma. And I was shocked by it. And that's probably how I got interested in researching this procedure, because I saw something that was not right. And I decided to take a deeper look into it. And I'm very glad I did. Yeah. So after they use the probe, they separate the head of the penis and the foreskin. And then they will take, it essentially looks like a big pair of pliers. And they put the pliers, a very long pair, into the top part of the foreskin, and they crush it. And so they're crushing the top part of the baby's foreskin with pliers. And the foreskin's the most sensitive part of the human body, of the boy's penis. And they go absolutely wild when this happens. But of course they're strapped down, so all you hear is just their screaming and their gurgling, and it's pathetic. Then they do that because they want to make a cut in that crimped spot that they make, so they can, open up the foreskin, and then they put on a metal bell, onto the head of the penis, and they pull the foreskin up over it, and then they attach a kind of a clamp that, goes down and it crushes the foreskin. So it strangles it to death. They leave that on. Sometimes lots of doctors will leave it on for several minutes, because that's how they control bleeding. It seals all the blood vessels. Okay. And then at the very, very end, they cut off the foreskin from the end of the bell. And then the procedure is pretty much over, except for, cleaning up the penis and waiting for the baby to hopefully, if the baby's still screaming, they will try to wait for the baby to calm down before they bring it back to mom, because they don't want to have to bring back this screaming, full of phlegm, crying baby who's now, they turn beet red during the procedure, which is interesting and not surprising. I'm sure the blood pressure spikes from this. It's horrible. And they break out into sweats, and they just look pathetic when you bring them back.
How old are they?
They bring in a happy little baby. I'm sorry?
Are they like days old, or is it like right after they're
born? Days old.
Okay.
Yeah. They usually, days old. Sometimes they will try to wait until they can give a vitamin K shot. So in case the baby has some certain bleeding disorders, they won't kill it. But they don't check usually for bleeding disorders before they circumcise, and that's why you'll see occasionally a case of a baby who has, considerable bleeding, or sometimes like the baby in Texas who died. Yeah. That happens about 116 times a year on average.
This is
based on one study.
The vitamin K shot. That's not the sole. This isn't the sole purpose of why they try to push that. Is that I know. I asked you this, and I wasn't sure if you found out the answer to that or not. No,
I think there's the vitamin K shots used not just for circumcisions. It's something that they administer to babies. They will give it to babies who are not being circumcised also.
Okay, yeah. Do they have a use for the foreskin after being circumcised? Do they do anything with it?
Yes, they can, and it's kind of disturbing part of the whole thing. Sometimes hospitals will sell the foreskins. They won't throw it away. They will package it, and they will sell it sometimes to companies that will do skin grafts. They make skin grafts for burn victims. Those are made from the cells of neonatal foreskins. They can, harvest them, and then they make these skin cell lines to create skin graft tissue. And as odd as it sounds, Oprah Winfrey's cream, her cream is made, it has human foreskin in the ingredients.
Really?
So she uses foreskins in her cream, it said. Yep.
Wow. That's a very visual thought. I buy cream, and to think that foreskins for your skin, that's weird to me.
Yes. Yep. Yeah. You have elderly women putting on, the fresh cells of infant foreskin and trying to have it be some fountain of youth for them.
Huh.
And there's actually a video of Steve Harvey. You have somebody from one of these, beauty lines come on, and she sprays them with this lotion, and then she tells them it's based on human foreskins, and he just gives the most shocked face. It's really terrible.
I can imagine what he was saying.
It's funny, but it's not.
No, I know,
his
but
face is great.
Yeah. Oh my gosh, that's just strange. In your opinion, as an RN, can circumcision sometimes lead to infections and/or require hospital care?
What happens sometimes with, anytime you have a cut, anytime you have any opening in the skin, it could become infected.
Right.
It's an opening for pathogens. Since you're circumcising the penis, it's a baby. It's a diapered baby. So that wound is going to be constantly exposed to feces. Maybe if you had a baby, knows, you got to clean up the baby, and that gets everywhere. And so it will get onto the skinned head of the penis, which is an opening now for infection, and into the actual circumcision site, the scar, the ring that goes around the penis. So that increases the risk of infection compared to a wound in some other place of the body that's not being exposed to feces all the time. I actually, made a joke to one of my friends. I said, imagine if, you went to the doctor and you had a cut and they wanted to put a bandage on your wound covered in feces. This is your dressing. That's what you do with the circumcision. It's,
Right.
And they say it's cleaner. No, you don't want to do that. It's not a good idea. And
are there stitches?
It's not something like parents are advised. No, and with circumcision, there's no stitches. When they put on and, use the bell and then crush the foreskin, it usually seals, helps to kind of connect the two pieces of skin. So there's no suturing after it. But sometimes if, you can have adhesions where the two spots will pull apart, and then they would have to go, and then that would have to be stitched. Or if there's bleeding from certain areas, when the baby gets home, they might have to take them back and have a stitch. And, if it's serious bleeding, sometimes they'll have to stitch, an artery or a vein.
Like cauteries?
And so, yeah, there's complications from circumcisions. One of the most common and serious ones, and this happens in about 1 in 10 boys, and probably everybody is going to know somebody who's had this, is called meatal stenosis. And that's really, that's because when you remove the foreskin, now the tip of the penis with the head is contacting the diaper right on the pee hole, and it's rubbing up and down on it constantly. And so it becomes irritated.
Right.
It becomes irritated. And since you've lost the artery that feeds that part of the penis too, when you circumcise, you're cutting off the frenular artery. That area doesn't have good blood flow anymore, and so it does not heal properly, and it just forms this scar tissue that narrows the urinary opening. And then you have to go in with, scalpels to reopen it on children. And that's a very traumatic procedure for children too. It's not as bad as the original circumcision, but it's terrible. You're operating on the head of a penis, and this is in 1 in 10 boys because they have a narrow urethra. Well, and that's directly related to the circumcision.
Didn't you say also that, because I was going to ask, what are the complications that can occur, after circumcision? You mentioned something about what happens sometimes at 6-month baby checkups, 6-month-old baby checkups.
Yes. Well, and this goes back to the myth, circumcisions are easier, circumcised baby easier to take care of and clean. No, it's not. With a circumcised baby, the aftercare instructions that we teach to parents are you have to pull back the remaining foreskin away from the head of the penis at every diaper change. If you don't do that, the wounded edge of the foreskin that's remaining will actually heal to the head of the penis, and since the head's also damaged, they fuse together. And so at the 6-month well baby visit, doctors always check to see how the circumcision is going. Right. And if they see any kind of attachment, what they'll do is they have to grab the foreskin that's remaining, the tiny piece, and tear it off of the head of the penis. And it's a very painful procedure.
Wait. Okay, so...
And sometimes they don't warn the...
They don't.
Yes. Sometimes they don't warn the parents, and the babies scream like it's, and the parents are shocked. They're like, what the hell are you doing to my baby? And it's like, oh, yeah, we had to pull it back. But they do it because if the parent says no, then the kid would need surgery later.
Yeah. And when would that surgery take place? I mean, like when they're older or...
Well, I mean... No, it depends. I mean, at that point, again, it's a cosmetic thing. It's not cosmetic exactly, but, it's something that could wait. As long as the boy is not having issues at that age, urinating, they might delay it. But there's always pediatric urologists who will see, we can fix this and this and this. And, so it's something that they could take care of surgically, but it's a complication of circumcision because parents are not taught properly how to care for the circumcised penis. They think it's supposed to be maintenance-free after a circumcision, but it's not. It requires quite intensive maintenance, especially during the first year of life.
Well, and you would think, and then they're thinking, though, if we don't circumcise them, that's going to be maintenance. But really, that's what's not maintenance, right?
There's no,
Right.
Yeah, right. There's no maintenance for it. For if you have an intact baby, quote-unquote, uncircumcised, there's absolutely no maintenance for it. I mean, if you want to clean your baby's penis who's uncircumcised, this is how you do it. Dunk him in the bathtub a couple times, Put his butt in the water, take it out. You don't need to touch him. He's clean. Okay? Yeah. There's no touching the foreskin, no pulling it back. You don't need to see the head. If you do any of those things, if you try to pull back the foreskin on a baby or a young child, you're going to damage it. You're going to cause it to become red and inflamed and swollen. And then the doctor will say, oh, he's got a foreskin infection. Well, actually, no, he's got the reaction because you keep retracting his foreskin and you're damaging it at every time. Because like I said, the first step in the circumcision is to jam the probe in there and tear the foreskin from the head of the penis. I mean, the reason they do that is because it's fused. They're fused together. You have to separate them. So you cannot retract a child's foreskin because you're going to break those adhesions and you're going to have your baby screaming and crying. And every time they pee, it's going to hurt. And then they'll start to retain their urine. And parents will hear about that. They'll say, oh, if they retracted the baby's foreskin over and over, it's red and inflamed. When the baby pees, he screams. And then the baby starts to hold his pee because it hurts so much. And then the parents will say, or the doctors will say, yep, he needs to be circumcised. His pee hole is closing shut. The tip of the foreskin is closing shut on it. No, that's not what's happening. You don't know the anatomy. You're causing this damage by improper care. If parents would just keep their hands off of their baby's penises like they do in the rest of the world, our boys would not be having problems. Right. And the rest of the world thinks that we're, completely bonkers for what we do to our boys, how we manipulate their penises constantly when we're, taking care of infants and small children. In fact, today I saw there was the American Academy of Pediatrics had their convention in Chicago over the weekend. And some friends of mine, a group called the Bloodstained Men, they interviewed the Indian honored guest pediatrician who they had shipped in from India to come and speak. Okay. And he said he is, horrified that we circumcise in this country. He does not recommend it. In India, a country of 1.3 billion people, except for the Muslims, they do not circumcise their boys. And he's like, this should never be done, only if there's a real reason to do it. So, and he says the rest of the world should take the advice of the Indian Pediatric Association, and we should, because they actually have intact boys and they know how to care for them.
Well, The AAP stated this, and I'd like to know what your response is. A procedure is well tolerated when performed by trained professionals under sterile conditions with appropriate pain management. Complications are infrequent, most are minor, and severe complications are rare. Male circumcision performed during the newborn period has considerably low complication rates than when performed later in life. What do you have to say about that? I mean, I could already say proper pain management. That's out, right?
Right, right. Yeah, there's no really good pain management. And even if you were to, be able to inject enough lidocaine into a baby's genitals, right around their sex nerves and hopefully not nick them or anything like that, okay, but it wears off. You know what I mean? Then the baby's going to be in agony anyway. But the dorsal penile nerve block that they use only numbs the top half of the penis. So when they actually go and they start cutting the underside and the frenulum, which is the most sensitive part, the babies go wild in pain.
So, okay.
They say complications. Now, you have to understand that they don't consider cutting off a completely normal, healthy, highly functional, and highly erotic body part a complication. They're throwing away part of your baby and it goes rotting in a trash can. That's not a complication to them. What they're talking about is, a complication like, did the baby have severe bleeding afterwards? Or did the area become infected? But the funny thing is that the AAP's also said, we don't have any idea what the complication rate is. Mm-hmm. So the statement is meaningless. They say it's infrequent, but we don't know what the actual rate is. Same thing with their position statement. They say benefits outweigh the risks, but they don't know what the risks are. They don't have accurate numbers on them. And they don't consider amputating a normal part of your body to be any kind of risk.
Why don't they have those numbers? I don't understand.
Well, when babies have complications, doctors and parents don't often, report it. It's not something that there's no clearinghouse of information on, how many babies have died from their circumcisions. Because when a baby dies, say from a circumcision, there was a baby just recently we talked about in Texas, the death certificate will probably read something like hemorrhage. He bled to death. They won't say, well, he bled to death because he had unnecessary cosmetic surgery on his penis called circumcision. So it will not be listed as circumcision. They'll say, oh, we had a baby, he bled to death. And that's it. That's how it goes.
What about when we were talking about that, where a doctor will pull the baby's skin back for the 6-month baby checkup if it starts growing in there? Do they report that?
No, it depends. What the doctor does is it's just like a matter. He's not billing you for that. He's just kind of correcting poor healing, or healing it's happening improperly because of his surgery. Okay. He's correcting it. He's not going to bill the parents typically. He might say, "I'll put a little, put some more Vaseline on it." But no, that something like that happening, that's not considered. It's not tabulated as a complication, and it's not considered when they make these position statements of benefits and risks. Mm-hmm. So right, so many things with circumcision are not being tabulated and collected in any way.
Mm-hmm. Do nurses and doctors...
If a baby dies or if, there's severe bleeding, they'll report that.
Right. Do nurses and doctors often refuse to participate in circumcisions?
I wouldn't participate in the circumcision because I find it to be unethical. And there are doctors and nurses who will not circumcise. We spoke with a Dr. Rhoda at the AAP conference a few years ago, and he was willing to be educated on the subject. And he does not circumcise. Now, he's a pediatrician. He ran a emergency pediatric clinic. He accepted education on the subject, and he stopped circumcising. And I actually believe he left the American Academy of Pediatrics in protest because of their circumcision policy now, actually. And yes, there are nurses. There's a well-known nurse that people in my community know named Marilyn Milos. And she was a nurse. And her and a few of her other nurse friends on the maternity floor absolutely just refused to participate anymore in circumcisions because they saw what we just saw, what we heard, how the babies react to circumcision. And they said, this is wrong. This is, a terrible thing we're doing, and they refused to do it at their own risk.
Well, in 1996, there's a Dr. Peter Rappo, and he said, as representatives of the American Cancer Society, we'd like to discourage the American Academy of Pediatrics from promoting routine circumcision as a preventative measure for penile or cervical cancer. The American Cancer Society does not consider routine circumcision to be a valid or effective measure to prevent such cancers. So that's interesting that he actually would speak up about that.
Yes, and those two. Oh, sorry. Go ahead.
No, go ahead.
I was going to say, and those two excuses are still so common.
Mm-hmm.
You'll hear mothers saying, "I'm having my son circumcised, so his future girlfriends won't get cervical cancer." And I mean, to me, that's just totally bizarre.
Or
you're the
urinary
parent
tract
of this
infections,
boy.
right?
Or urinary tract infections, and what you'll see is with
or HIV.
they start talking about urinary tract infections,
Uh-huh.
or HIV, right? If you remove enough of your penis, you might not get AIDS.
Yeah.
I could believe that, because if I probably remove all of my penis, I'll have a 0% chance of getting HIV. The less surface area on a penis, the truth, you might not get as much HIV. But you know what happens? In a place like Malawi, the country Malawi, they circumcised their men, and what happened? Their HIV rate, infection rate, went way up. So it's like, hey, what happened here? We just circumcised all of our men, and HIV infection rate is going up. Well, it's because when a man is circumcised, the head of his penis becomes rough, and he has to pound away on his partner, and that causes little tears in the vaginal walls and everything like that, and really, blood comes out, and that's an infection portal for HIV. So, there's different studies from around the world saying, oh, maybe it reduces it, maybe it increases it, back and forth, But my point would be this. Why are you talking about circumcising an infant? Infants are not sexually active. If that man wants to be circumcised later in his life to possibly have a lower risk of HIV by removing the most sensitive parts of his penis, I would leave that up to him. I don't think that's a decision me as a parent I'd be comfortable at all in making.
Right.
If you look at what some of these societies say, oh, there's a benefit of circumcision here. It's always something that you could wait until the child's old enough and ask them, hey, do you want to have part of your penis cut off to help you possibly have a lower rate of giving your, a partner cervical cancer? So you could wait on that one. I would ask my son if he's willing to do that. But we now know it causes cervical cancer. We now know it causes penile cancer, and it's human papillomavirus. It's a virus. It's not foreskin, So as we learn more, all of the old excuses, all the old reasons start to fade away. Like the American Cancer Society said, stop saying that. That's based on old science that's not considered, nobody takes that stuff seriously anymore. It's pretty much what they were saying.
Do you know
Stop pushing that crap on parents.
Do you know if there's a link for erectile dysfunction with either having it or not having it? I mean, I would assume not having it.
There are studies really from around the world. Some of them have found that erectile dysfunction can be 4 to 5 times more prevalent in circumcised males, and that totally makes sense to me because of the tissue you're removing.
Right.
You're removing around 75% of the nerve endings from the penis. So like the nerves in the frenulum, when that stretches, when the nerves in the foreskin has a lot of muscle tissue in it that keeps it closely pulled over the head. When that retracts, it makes the Meissner's corpuscle nerve endings fire. And all of those things are signals to the penis and to the body, keep the erection. If you start altering the nervous system of the penis, yes, you can, get increased, rates of impotence and weak erections. And yes, there are studies. There's studies that have come out from around the world, and I've seen them. Numbers around that 4 to 5 times more prevalent. In other countries, they'll try to dispel those those numbers and come up with some of their own. But I firmly believe that circumcision causes a variety of sexual dysfunctions.
Well, Justin, we're going to take a quick 30-second break, and we'll be right back.
Got something to say? Get in on the conversation at 415-915-2291. That's 415-915-CALL-1.
Welcome back, Call Nation. We're here with Justin. If you do have a question or comment for him, if you're streaming on our YouTube Live, which is Conspiracies Against Wellness live stream, you can write it in there or comment in there. Or if you'd like to call in, you could call in at 415-915-2291. I'm sure he would love to field any questions that you may have for him. Justin, I was wondering, so I asked you earlier if nurses and doctors refuse to participate in circumcisions. If they refuse to do that, are there consequences for not participating in this or being involved?
If a nurse has an ethical problem with it, they can conscientiously object to taking part in the procedure. But if you do that, yes, I mean, in reality, you're putting yourself out there. You're putting yourself on a limb. The people you're around, this is what they do for work.
Mm-hmm.
A lot of them make their money doing this. So there can be consequences, certainly.
Have you had any?
If you live in a country that circumcises, and your doctors that you work for are making money circumcising, they're not going to be too happy with you if you refuse to partake in circumcision.
Right.
Then they're going to have to be getting all their tools themselves.
Did you get any pushback for not wanting to participate in it?
Well, what happened with me is I watched the first procedure, and it was disgusting. It was horrible. And later, they were like, does anybody want to go watch? And I was like, no, I'm never going to watch one of these again. I'm never going to participate in anything like this. It's not medicine, you know what I mean? You're just torturing an infant for these silly reasons. And I did not want to have any part in, torture. I'm not into torture.
Either am I. So this isn't only like a health thing, though. This is about religion, too. And I was wondering if you can talk about the differences within the Christian religions, maybe Muslim, Jewish, of why they do this or why they don't.
Circumcision was first found in Egypt. Slaves were circumcised. Slaves were castrated often, and it was to mark a slave. It's also to reduce sensitive tissue on the penis. But you could always say, oh, that's a slave. You could see the head of his penis. Later, the Jewish people started to circumcise, as they would say, it's the mark of the covenant between them and God. There was a story in the Bible about Abraham about to sacrifice his son, but it said God stopped him, and then he said, nope, instead we'll circumcise the child. Circumcision is a religious sacrifice, many people say, because you're sacrificing the most sensitive part of your body, your pleasures in this world, for pleasures in the afterlife. And the greatest Jewish scholar, who is Maimonides, said that the purpose of circumcision was to, remove sexual pleasure and to weaken the penis. And he's like, that's the reason we circumcise. And he also said because women seem to like having sex too much with uncircumcised men, and that's another big reason that we do it, he said. Mm-hmm. So when you look at the actual old writing, sometimes it's really disturbing. Maimonides was very disturbing. Same thing with another Jewish scholar named Philo of Alexandria. He also said the purpose of circumcision was to remove the pleasurable tissues, because it's a sacrifice. Mm. The sacrifice doesn't have any purpose if it's not like, it has to have meaning. It has to be something you're actually sacrificing, something important.
Okay. Well, and in today's shows even... go ahead, I'm sorry.
Oh, no, I was saying... so the Jewish people circumcised, yes. And today you'll hear a lot of people will be saying, oh, the Jewish people back in, the ancient times, they did it for health reasons and this. Well, that, you could really go back and forth with that, because think about it. The Jewish people had a law. If you have 2 of your sons die from their circumcisions, you get to skip the 3rd one. So right there doesn't sound like a health thing to me. Also, you have to remember, back in those days, they were operating on children with flint tools or knives, not sterilized. There was no sterile medical equipment. There was no antibiotics, no modern equipment if anything went wrong, and no sterile bandages for after the procedure. So yeah, back then the infection rates would be much higher. The people were not, trained back then in the way we would consider, training today, taught by one generation to the next. So yes, the complication rate back then would have been much higher. When people say, oh, they did it for health reasons, I would just say, well, we know today that bush circumcisions really kill a lot of people.
Well, and
by looking back at their rules, it seems to say the same thing.
Don't they do something during their ritual too? Like that's just different?
Yeah, well, but yes, and there's a practice called the Metzitza B'Peh, and that's the ceremonial after circumcision brief blowjob where the rabbi or the mohel, the ritual circumciser, puts his mouth on the fresh wound of the penis and he begins to suck. And they believed back then they were sucking out the bad blood, the demons, and they would spit into the wound to clean it, kind of like a cat, I guess, They would spit into the wound, into this fresh wound, because they thought it was cleaning it, suck out the bad blood, and then the ritual is over.
And what's the problem with this? Yeah.
Well, it still has carried over today.
Okay.
And so it's, again, I said, it's not really about health because they're giving the baby a blowjob. That's not normal. That doesn't seem appropriate to me, But so what happens is if you have a cold sore, say, let's say you have herpes.
Exactly.
If you put your herpes on the fresh wound on a child's penis, you're going to possibly infect the baby with herpes. And babies can die from herpes, or they can get brain swelling. It affects them very severely. So that happened. That was happening in New York City. This practice is common among some ultra-Orthodox Jewish sects, and they would have the rabbis come around and do this practice, and the babies would get infected with herpes, and sometimes they would die. And so the New York Department of Health tried saying, please, can you stop doing that if you have herpes, because we don't want you killing babies. And then there was a big pushback that claims that it's being anti-Semitic. You're trying to infringe on the rabbi's religious right to give the baby a blowjob. Right. You're infringing on his rights to suck the baby's penis. The baby's rights are not important in that situation. It's just the adult man. That's what, it's his religious obligation, he believes, to do that. That's the safest way to do the procedure. He believes. That's what he's taught. And unfortunately, they tried to get, restraints put on certain rabbis who had cold sores, but eventually they just said, no, we're not even going to do that. We're not going to do anything about this. And so it continues today. Totally legal. If you want to have your child mutilated at your house and call up somebody to put his penis in his mouth, you're allowed to do that.
And
United States of
even
America,
if they have herpes, the parents are okay with that, or
even if they have herpes,
yeah,
you don't know. Herpes, oral herpes, is just so common.
Yeah,
it's very common. Lots and lots of adults have it. I forget what the exact numbers are, but it's extremely common.
Okay.
I'm not sure if it's, what the rate is.
No, you're right. You're right. I've never had that, but you're right. I remember my girlfriends, I always ask before I share chapstick, do you have that? It's because it's a cold sore, right? But that's what it is. It's a herpes.
Sure. If you have a cold sore and if you have any kind of shedding, the herpes virus will go right into that wound and you're infecting the baby with herpes possibly.
Wow.
And the baby could die. But so you don't know if you will not know if the person who's going to suck on your baby's penis has herpes. You're gambling, you're rolling the dice with your son's life.
That's scary.
Because of this. It's very scary. There are no, where circumcision is involved, all ethics and all common sense kind of laws and everything go right out the window because people invoke religion. And, and that's why it continues. Nobody wants to say, this should be stopped because you'd be labeled being anti-Semitic. Mm-hmm. I could talk about it. If half of my family's Jewish, the sect that half of my family is from, today they use a little glass straw. They no longer put their mouth on the baby's penis or spit in it. They use a straw to suck out the blood. So, that's how sometimes these things, evolve into the modern times. Mm-hmm. So certain sects do not actually suck anymore. They use a glass tube.
So what reasons would a boy or a male adult have a circumcision later in life?
Well, in the United States, it's because he grows up and he hears all this body shaming on the TV, on movies, on shows like Sex and the City, where they push this myth that the foreskin is dirty, it's got lint underneath it, it's it can't be cleaned, it's disgusting, it smells, all these kind of things, and none of them are true. If a man takes a few seconds and cleans his penis, which is not hard, as clean as can be. There's absolutely no problem.
Is there
But so it's a
medical
body
reasons?
shaming issue. In the
Right.
in the United States, it's because of body shaming. We fight body shaming in every single way, and in every case, except if a guy is not circumcised. Then you could bully him all you want, and people will just laugh.
Well, even
You know,
in
it's an outlier.
right, even in our normal everyday programs like Shameless on Showtime, the son gets a circumcision when he was like 16 or something because his girlfriend wouldn't have sex with him. So in order for her to have sex with him, he went and got circumcised. Or Game of Thrones, the Unsullied, they would fight better because they wouldn't even be thinking about sex then. You know, it's pretty crazy.
Wow.
Yeah. Well, yeah. Well, they call him the Unsullied. It's her. It's Daenerys. Yeah, they're castrated there though, but it's Daenerys. She's a leader. I don't know if you've ever seen it, but she wants her troops. She buys them so she can free them because they are slaves at that point. But you know, she doesn't know it at first of why that they're like that, and you find out. It's pretty crazy, but it's just interesting to see what our TV programs do. I think there's a Grey's Anatomy episode that talks about this. There's a whole bunch of them, you know. It's interesting how it falls into our pop culture as well. So, just like in Shameless,
and in American media, sure, it's so prevalent. Because they want to push this idea that being circumcised is normal and not is somehow you're stigmatizing people. You're calling them unclean. You know, you're allowed to bully people who are uncircumcised. We would see, you know, it's so amazing when you do this type of work, educating people. You'll see people shaming small children, saying, "Oh my God, look at them! They're disgusting." They'll be judging the child's penis, and it's like, no, wait a second. This is a child. We are not looking at them like that. That's not normal. You're not allowed to bring back a baby and say, "Look at his beautiful circumcision. The doctor did a great job." You know, no, we don't look at children's genitals like that. We're not supposed to be judging them and deciding if they need surgery because of cosmetic appearance.
Well, and,
you know, because of your strange cultural cosmetic, you know, appearance preference.
And if you think about, you know, you're not allowed to get abortions and stuff like that because of the child. The child should have a choice. Well, shouldn't the baby have a choice? Right? Like, shouldn't they have a choice of choosing whether they want this or not? Let them do it later on in life if they want to.
The baby, and right. If you let the baby make his own choice, and everybody knows this, the baby will grow up into a man, and men essentially never want to have it done. It's like two in 1,000 will ever want to have it done. And it would be because of, like, the guy in Shameless. He meets some bimbo who is so superficial, she doesn't want to be with him because his penis has all its parts.
Is there any medical reason?
It would be like can you imagine what would happen if you reversed that situation and he would no longer, you know, he wouldn't want to be with her because her labia was too long. Or he called them, "Those are her mud flaps. Get those trimmed. I'm not going to be with you unless you get female cosmetic surgery."
Aren't porn stars and stuff getting this done in the female version way?
Yeah, well, absolutely. Yeah, female genital cosmetic surgery is huge business now. And also, that's also because of, you know, a type of shaming.
Right.
I don't have any problem with that because that's adults doing that to themselves. They're making that choice. I personally would tell my girlfriend, "I love you. You do not need surgery. Stay just the way you are." You know, because I think that's disgusting to judge somebody based on their body like that. You don't like them, you know, okay, leave them. You're a shallow person. You can leave. You don't like it. I would not operate on my child because I'm anticipating that one day they're going to date some shallow bimbo. You know, it's absurd.
Is there a reason medically to get it later in life, to get a circumcision for a male?
When you see, what you see is, oftentimes with the people who are getting circumcised, they'll say, "Oh, you know, I have a condition called phimosis, a tight foreskin. I can't pull it back." Usually the reason men develop that condition is because of improper care from the parents when they were a tiny child. They're pulling back the foreskin, trying to get it to go back, they're damaging the opening. Mm-hmm. So the man grows up with a damaged foreskin because of the parents, then he has phimosis. Then he goes to a doctor, and the doctor might, you know, say, "Okay, yeah, we could amputate the entire foreskin."
Hey, Justin, just an FYI, make sure to keep staying close to your microphone. Sorry about that.
Sure, sorry.
Okay, thank you. There you go.
So the man has a tight foreskin, and the doctor might just off the bat recommend circumcision. And there are other treatments for tight foreskin. You could treat every case of tight foreskin. There's a steroid cream you can apply. And if that doesn't work, you can use an expander. And you can expand the opening as wide as you want. You know, if you just give it a little bit of time, you can avoid surgery. If you don't want a circumcision for that condition, there's a bunch of other minor surgical procedures you could do and spare the foreskin. But they don't ever really try to do that in the United States because they think that cutting off the entire foreskin is a good idea, even though they don't know what the structures and functions are. And also sometimes if a man, say, has, and in my entire career, I've seen one case of a man who had a foreskin problem, and I've worked in a lot of different settings. So foreskin problems are not something that you will see often in, you know, in a medical career. If you work in like certain units, it's just very rare. But, you know, if a man gets a minor inflammation or something like that, again, they might say, doctor might recommend circumcision instead of, you know, just treating it shortly with some, you know, antibiotic cream or an antibiotic. And same thing with, I'm sorry, go ahead.
No, I was just going to ask, how is circumcision different as an adult than a baby? Like, what's the differences on those?
Well, as an adult, you get to be put to sleep.
Right.
Okay. So you have completely adequate anesthesia. You don't feel a thing. You know, you're fast asleep. You wake up and it's done, and you're receiving pain medication. So you're comfortable. Babies are cut many times without any type of anesthesia, or they might get the Emlich topical cream or the shots, but the shots only numb the top half of the penis, and the underside is still very sensitive, and the babies still cry and are in a lot of pain from the procedure. And then it wears off, and the babies are in agony.
Right.
Men are not. Men get to go home and get Percocet or Vicodin, and they're comfortable. And the adult man is also not diapered. He's not pooping on his penis every time and, you know, and soaking in, you know, that, which causes it to become, you know, very painful.
Do they have stitches?
And the best part
for
about
adults?
doing it to a man is the best part is the man has actually got to make an informed personal choice about his own body.
Yep.
You know, if he wants to choose circumcision for whatever reason, great. That's his personal choice, you know. It's his body. If he wants to get circumcised, let's say, great, man, go for it. But that doesn't happen usually, you know. And so, yeah. And the man also gets to decide what type and style of circumcision he wants.
Really?
He gets to decide if he wants the ultra-pleasurable frenulum removed, you know, which would be an insane thing to do. He gets to decide how much of his inner foreskin he gets to keep, which is the sensitive tissue of the penis. You know, so there's a lot of different styles. When you go and get your child circumcised, you have absolutely no idea what you're going to get. First of all, it's a tiny organ you're operating on, and every tiny little tug will have big consequences when that child grows up. Mm-hmm. And so it's, you know, it's an ethical issue. We don't operate on healthy children. It's just a basic kind of tenet in medicine. You do not resort to the most drastic treatment in medicine either. You start from the bottom up. You know, you start with the cream or the pill. You don't jump right to amputation.
Right. Do you heal easily getting an adult circumcision? Is there stitches involved? What
adult
is that like?
Circumcisions, it depends. In adult circumcision, we push in Africa now. Americans are going over there to push circumcision because they think it helps HIV, even though the numbers on that are very skewed. So it might help a little bit. And if an adult in Africa wants to circumcise, it's fine. But they use these devices now where they put it on, and the foreskin, you know, they clamp off the foreskin, and over the next week it might rot. And then they go back and they have it taken off, and there's no sutures. They just
stay by your microphone.
Clamp on it. Oh, I'm sorry.
Sorry, there you go.
Yeah, so in Africa they will use a clamp device that it doesn't cut the foreskin off right away. They wait for it to die and rot, and then they wait a week and they cut it off. Or in places like the United States, you could have a surgeon do it, and they'll use sutures. And it takes about the same time to heal as kind of any other surgery for an adult. You know, you might need to be off your feet for maybe a couple days, but many times, you know, people are up and about very quickly, and the actual healing process takes a few weeks at that point.
So if they're pushing this over in Africa, what's the real... I mean, obviously there's no real stats out there to say anything about HIV, and I would be afraid to do anything over there if they don't have a lot of good medical places, do they? Or maybe, I don't know, maybe they do. But, like, is there to make money? Yep. What is their reasoning? I mean, I know what they're saying.
No, they're pushing. They've done some studies in Africa, and some of them have shown that maybe HIV might reduce the rate, or circumcision might reduce the rate of HIV, or some of the other studies showed the opposite. And their methodology is often obviously very flawed, to give a certain kind of result. But if they want to circumcise adult men in Africa, they will, set up these tiny, little clinics where they try to do it medically and, and sterilely. They try to do it safe so the men can, they won't get infections, hopefully, and it's done in a medical type of setting. They might educate nurses how to do it. And they keep coming out with all these different products that, they can use to circumcise. But what they're going to do is it's going to go from voluntary male circumcision in those high HIV prevalence places, and then they're going to try to start pushing it on infants too. It's not a voluntary thing.
I saw an article though, and I think it was Uganda, that 3,000 young males came out and they just did it in their town hall area. You know what I mean? Outside.
Yeah.
That's pretty crazy. What's their reasoning there? The same thing?
That's what we would call bush circumcisions. Where they just cut the boys with dirty knives. And the funny thing is you never hear anybody protesting against that.
Right.
Everybody's just like, oh, that's just what they do. They just operate
Culture,
on
right?
the boys. But if they did it to the girls, then it's a big problem. You're allowed to cut boys with dirty knives in whatever setting you want. And it's fine. Nobody's going to say a word because you don't want to start talking bad about circumcision because, hey, well, we do it too. Yeah. But no. So it's a very sexist type of thing that you can do anything to boys. You can cut them with any kind of knife. And yes, in Africa, they do it sometimes as a tribal marking. And, as part of your marking to be part of this tribe and part of the community. So you have to be mutilated as an adolescent.
Interesting.
And it is. It's a very disturbing thing.
Yeah.
And with now what's happening is they're forcibly circumcising people around Africa. They will be, there's now politicians in Africa saying, oh, you shouldn't be allowed to run for office unless you're circumcised. So it starts to get really crazy over
interesting.
there.
Wow.
Yep.
So why isn't the topic of circumcision spoken about more often openly? What's going on?
Well, I guess it would be me going over to my friend's house and be like, hey, Tom, let's talk about how we both have damaged, mutilated penises. Nobody wants to go and do that.
Right.
It's just an uncomfortable topic for men, and there's not a lot of guys who would want to go out there and start talking about this. I was damaged as an infant. This is a bad thing, actually.
Well, then
we're not perfect sexually.
How are we going to start changing this issue? Where does it all start?
I think it starts from shows like yours.
Okay.
We start getting the word out. People start researching. They start to actually use a little bit of common sense and think about it. They hear these arguments that now we realize are so silly. They make no sense. Oh, baby has to match daddy's penis, or, mommy likes the look of circumcised penises better, and so she's going to cut her baby. Or, the bully in the shower. Those are very silly, stupid reasons. We just expose those. People start to think about it for a little bit. And they're like, yeah, you know what? That's really stupid. I'm not cutting my child because of some junior high school shower bully or because daddy wants to have matching sex organs. We'll buy them matching hats or something. So they start to use some common sense and they'll start to research it. And then that's all it really takes. You start to do some basic research, watch a few videos about the procedure, see what it actually is. And the reality of it is disgusting.
I was surprised, though, when you told me, the millennials and the younger kids are actually the ones that know about this stuff. I had no clue. And do they teach them in school, or how do they know this? Internet?
Internet, yep. They learn about it from the internet because now there are groups that come out and educate. There's people like me who will go around and educate. If I see, a pregnant woman, give them an informational card. You can visit these sites. There's a bunch of sites that I think are great. Intact America. There's a site, Your Whole Baby. There's a site, Saving Sons. And those sites will give you great information on how to care for your whole baby and why you do not need to circumcise and all the silly reasons and myths that surround it. So people go to those sites, they start researching, and they realize, yeah, this is a silly procedure, and I'm not letting this happen to my son.
Yeah.
This is not a good thing. And millennials, yeah, they're very computer savvy. They're not easily fooled.
No.
Okay, they're dumb as dirt in some ways, right? They might not know what the ocean is on this side of the world, but they are very good at like finding out the things that are not right in the world right now.
I think it's interesting.
I found that they're very easy to educate.
Yeah, my I have a brother. He's 19, and I remember a few years ago, he was like, "Oh, if I was flying a plane, I could totally fly it and land it." And I'm like, "How are you going to do that?" And he's like, "Because I do it on my Xbox, whatever system." And I'm like, "Uh-huh." And he's like, "I know it all." They're very book smart, but I don't think they just have the experience. But they have a lot of promise, I think just get a little bit of experience
they do.
behind
They're going to change our world in some kind of way.
So I have a question then. So do you think coming up as they come of age, they start having children? How do you see this all turning out? Like, do you see this shift like really changing and going down?
Oh, I believe there's going to be a tipping point where already circumcision is collapsing. The numbers are dropping. People are getting educated. Doctors are getting educated, saying, "Oh, we don't want to do this. We don't want to damage these children." They realize that it is sexually destructive, and so all the old myths go away. And so now, when I was born, 80% of the boys were circumcised. So my generation growing up, it was 80% cut. But a lot of people in my generation are fighting back against it and educating. And so when the circumcision rate's 50%, pretty soon it's like it's normal to have a foreskin. And circumcision is going to seem even more absurd and more barbaric. And pretty much, as the numbers of intact people go up, the myths are not going to survive very long, and circumcision will start to collapse even faster, I believe.
Are there any ways that we can change legislation for this? Or is there anything going on within legislation that we all need to look at and say, okay, we can do something about this?
I would always, tell people if you think something's not right, contact your elected officials and say this isn't right. But legislatively, there is. First of all, there's a law against female genital mutilation.
Mm-hmm.
That says you're not allowed to cut the genitals of females for any reason. Okay, it's if you have a religious obligation to trim your daughter's foreskin, you are not allowed to do that. They said that's not a good enough reason. Unfortunately, that doesn't apply to boys. There's a different standard for girls' genitals and for boys' genitals. Hopefully, if we can make a 14th Amendment argument that boys deserve equal protection under the law as girls. And there's an interesting case going on right now in Michigan. And there was a woman who had her daughter circumcised up in Michigan. They did a little trim of the foreskin, a procedure that's far less damaging than a typical American male circumcision. A religious obligation to cut the foreskin.
Okay. Like in one of the Muslim areas?
Yes,
okay.
Yep. And they will also claim medical reasons and, cultural reasons and sexual reasons. They have a ton of reasons why they do it too.
Mm-hmm.
All as silly as ours. But so she circumcised her child and was arrested. And she got I forget which one now, but one of the lawyers from the O.J. Simpson trial to defend her. And so they're putting up the argument that if boys are being circumcised in this country, she should be allowed to circumcise her girl too, because what she did is actually far less damaging. And whichever way that case turns out is going to be extremely important.
Yeah.
It's going to be a big case either way it turns out.
So all right.
That's something to watch for.
If that wins, what will happen? Can you give us like a quick pro of like what will happen if they win or they lose?
Well, that case, it's interesting. That case, there's already a law. There's already a federal law against female genital mutilation. But if they say, okay, no, you're not allowed to do that, well, then they're kind of treading on the territory of, okay, males should not be allowed to be circumcised for religious reasons either, because otherwise it's a different standard for boys and for girls. You can't say that the genitals of one sex should be protected against religious mutilation and the other should not. And if they find that it was okay for her to circumcise, say, on a state level, well, then, they're condoning female genital mutilation. And what I've found educating people is that it's actually very easy to get Americans to support female genital mutilation. You just ask them a question, say, well, what do you think about women, about mothers in this country having their pediatricians cut off their daughter's foreskin? Mm-hmm. And you go through their reasons why they did it to their sons and have a little bit of a conversation, and they end up supporting female genital mutilation too. and then I tell them they're a disgusting person. Because they don't want to say, okay, I was wrong to circumcise my son. They'd rather say, okay, fine, they could do whatever they want. They'll say it's the mother's personal choice to circumcise their daughter.
Wow. Well, is there anything else that you'd like to add before we get going here? And by the way, thank you so much for coming on. I mean, what great information. I learned so much. It's crazy.
Yeah, no, it's a great show. I would just want to tell everybody, circumcisions are an ancient barbaric practice that somehow managed to make its way into the modern day. We've done everything we can to try to doctor it up. It's like we put lipstick on a pig, trying to make this thing seem not so bad. But it's a disgusting, sexually damaging practice. And if you leave the choice up to your son, he's not going to want to have it done later on.
Right.
Okay? I would respect the choice that your son will make in the future. You don't need to wonder, what is he going to want, which way. If you're worried, don't circumcise him. And if he doesn't like it, he can always get circumcised later. But protect your boys.
Thank you so much for coming on again, and great
Thanks,
information. Yeah, and I mean, I want to give a quick thing of what I think, and maybe if you wanted to, but I just see this as a money thing.
Sure.
I just see that it's a way that doctors make money. What you said, $300-400 a pop for each one. Maybe there are some religious aspects to it, but overall, or it's just basically cosmetic. A penis isn't pretty, or it will get dirty, or whatever. But all these are myths.
Right, and and it's a penis. I don't know whoever said it. The vagina was supposed to be pretty, or the penis was supposed to be pretty. It's not supposed to look it. It's supposed to be a functional sex organ.
Right.
So we don't want to alter its form and function, trying to make it look pretty. Because that's just silly.
Right. Well, and I wasn't realizing, even when you're talking about when you're an adult, if you get circumcised, you can say, okay, well, you know what? I want the lower skin on there because I'll have more, nerve endings, and I'll feel more, and I'll be able to, I didn't realize that, the different things that they could even do. So that right there, you would think that, if we could get a little bit of education on this, which, by the way, I did see some of the groups, which they come out against you pretty much, or what you're trying to do. But they say, you can't even find information on circumcision anymore because these anti-cutters or whatever, they're all over now, and they're taking it away. And I'm thinking, no, you guys are the ones that I see about. I don't see people that are fighting against this, really. I didn't know about it very much. I've heard about it. I've heard of the controversy. I didn't know much until I spoke with you.
Yeah, right. No, that's exactly right. And you know what I mean? It's the people who learn about it and research it, then they often become very passionate about it because they're like, oh my God, this is really a bad thing that's happening in our country, and they want to make a change. That's why I do it. I find it's not ethical to do this. It's not medicine, and as if you look at just the rest of the world, look at Europe, look at Russia, China, Japan, South America. These places don't circumcise, and they find it barbaric what we're doing. And and it's like the men are not dropping dead, from foreskin infections and stuff like that. I mean, it's just ridiculous. You want to know if foreskin things? Just go look in the rest of the world. If you want to know if I want to circumcise my son now because he might need it done later, just do a little basic research. Okay, it's like if your son is so unlikely to ever have any kind of a problem, that's the dumbest argument ever, that you're going to guarantee he gets the surgery as an infant because you're worried of a tiny chance he might need it later.
Yeah, well,
it's absurd. But nobody challenges these myths.
I heard an
people
interesting
say it, and
thing.
everybody just stays silent.
I heard an interesting thing, too. You have a lot of these anti-vaxxers and stuff out there fighting so hard so their children don't get vaccines, which, I mean, I don't think they should be mandatory, and everybody should have the right to do their due diligence of research, and if they don't want to get them, they don't need to. But they'll do that, but they don't fight or want to know anything about the circumcision part. So why, it's, I don't know if you've ever heard that, but I'm seeing some interesting correlations between both of them. I don't understand it completely.
You know what it is? It's like if people know if they don't circumcise their child, there might be some kind of a social consequence to them, or they worry about the child. You know what I mean? Like somebody might say, oh, did you hear, Jenny didn't have her boy circumcised. How stupid is he?
Yeah.
when in fact she's the smart one because she actually researched the structures, the functions of the foreskin, how it's done. The people who are saying how stupid she is, she thinks they're so stupid, they're actually the people that know nothing about it. Because I have not yet seen a parent who we've educated.
Stay close to your microphone, please. Sorry.
Sorry. Yeah, I when we educate parents, I have not yet found one who's been like, oh my God, you're right. Look at all this. This is horrible. Who's then gone and circumcised their child.
Yeah.
Once people become educated, they become, very much against this.
Absolutely. Well, again, thank you so much. We're going to get off here, but in Call Nation, I just wanted to say thank you for listening in. If you have any questions or comments for Justin, I'll be sure to pass those along to him. And, Justin, you are pretty amazing, and what you're doing is amazing, and I really hope that we work together in the future. And so, okay, I guess we're off. So, all right, thank you again, Carnation, for listening in. Next Tuesday, 8/7 Central, we will have Janine DeRose on. She is running on the California State Senate District 6 Libertarian Party ticket. Very interesting information that she'll have to give out. She wants to talk about her campaign, and we'll learn a lot from her. We did have Austin on last week, so I think it's fair to be able to hear what she has to say. I hope you all have a good night, and thank you for tuning in.
You've been listening to Conspiracies Against Wellness with Janelle Elgoway. Join us next week to get in on the conversation. The opinions expressed on this program are those of the host and callers, and not necessarily those of EXG, LLC, its employees, or sponsors. I'm David Schiff.
The Cause Show with Janelle Elgoway is copyright 2017 by EXG LLC. All rights reserved.